Hello, 1, 2, 3. Fine? Okay. Hello. Are you? When is the dinner? Fine, sir. Will be in camera.
Good morning. I'm audible, ma'am?
Yes, ma'am.
Okay. Namaste. I, Kavya Malhotra, on behalf of SL Suri DAV Public School Janakpuri, welcome you all to today's session on awareness of COVID appropriate behavior. It has been 10 months that we are trying to adjust ourselves and accept the new normal. But still, there are a few etiquettes and behavioral patterns which we need to follow in public. So I invite Dr. Sandeep Bhalla, Public Health Specialist, Ms. Vandana, Health and Wellness Coordinator, and Ms. Shweta Sharma, the school counselor, to shed some light on the same. Please, ma'am. Please, sir.
Are in pandemic situation for the last 8 months. We all know that COVID-19, what is pandemic? We just don't. So we have to coexist with this by following some of the behavior. As to the principle, your COVID-19 doesn't for that. Hello. Good morning to all. As we all are in pandemic situation for the last 8 months, that is COVID-19. We all know that what is COVID-19, from it, where it comes, and what are the signs symptoms. But the only thing we are worried about it, there is no vaccine yet, and when we are emerging out of it. COVID cases are increasing day by day as per the current scenario. Till October 12, there are around 71 lakh 20,000 and 500 cases are there. Out of it, 86.4% has recovered, 12.1% are still active, and 1.5% are dead. First case of COVID took place in China, in Wuhan, in December 19. That's why it's named as COVID-19. And in India, it was reported on 30th January 2020. It's characterized by the symptoms like sore throat, fever. Basically, high fever is there and it lasts for 3-4 days. Muscle pain, fatigue, shortness of breath, that means difficulty in breathing, and loss of taste and smell. Now, point comes how it spreads. The virus spreads through the respiratory droplets from an infected person when it sneezes, cough, or talk. The virus-filled droplet can land in and pass into the mouth, nose, or eyes of nearby person and be inhaled into the lungs, and can also land on the commonly touched surfaces like door handles, doorbells, phones, laptops, table, chair, etc. Now the point comes how we can protect ourselves from this virus. For this, I would like to invite Ms. Shweta, our school counselor. Shweta, hand it over to you, ma'am.
Thank you so much, ma'am. Welcome, parents, and welcome all students. Today, we are going to talk about COVID-19, like how it's spreading throughout in our society. So, as Vanda ma'am has told us regarding that how it started actually. So, let's talk about what are the how does it spreads actually. So, COVID-19 spread through certain symptoms, and of course, the virus is thought to spread from person to person when they are to close contact, and of course through the droplets of the person. And when the infected person is sneezing and coughing, at that time it's spread out. So at the same time, when you are touching your other surfaces like your doorknobs and gate, at that times it spreads. So how does we slow down the spread of coronavirus 19, right? COVID-19. So there are certain ways like wash your hands and stay 6 feet away, and of course wear a mask and proper mask, and avoid touching your eyes, nose with unwashed hands, and clean and disinfect the surfaces, right? So when we are talking about what is coronavirus, so we're also focusing on the preventive measures and what are the appropriate behaviors. Like we can say appropriate behaviors are certain behaviors that actually reduce the spread of COVID-19. And right now, in this new normal situation, we have to follow these preventive measures and appropriate behavior to reduce the spread of coronavirus, right? After this festive season and unlockdown time, we're having so many cases are rising up daily. So there are certain preventive measures and appropriate behaviors what we need to follow. The first one is very important, hand washing, right? And there are certain steps of hand washing that we need to follow, and frequently washing your hands with soap, and of course till 20 seconds. And you can sing happy birthday song, you can hum happy birthday song. The another step is how to wear mask, but how to wear mask, it is a very important thing, because right now nobody is taking care of how to wear mask. We need to wear masks properly when we cover our nose and of course our chin and cheek. So this is the proper way how to we need to wear mask. And you can see the slides that how can we need to wear proper mask. The third one is, and very important, is social distancing, right? Maintain social distancing. There are certain do's and don'ts that we need to follow. What are the do's that we need to follow for social distancing? That we need to maintain 1 feet. We need to be away 1 feet from the other person. And of course, when I'm talking about social distancing, it is actually to maintain social distancing, maintain as well as physical distancing, right? There are certain don'ts are also here that we need to follow, like of course cancel your two trips, and whenever you are going away, just maintain, whenever you are going malls and market, maintain your distance, social distancing, and of course physical distancing, right? So as well as we need to follow our how to greet others, like say namaste, and avoid handshaking, right? So these are the certain ways to, these are the certain appropriate behavior that we need to follow. And there are three C's which are very important. The first one is that we need to avoid, actually. The first C that we need to avoid is crowd, and don't go crowded place. The second one is, close spaces, and with poor ventilation. We need to avoid close spaces. And the third one is very important, is close contacts, right? We need to avoid these three C's. So these are very important preventive measures and appropriate behavior that we need to follow. Whenever you are going out for anything, just wear mask, keep sanitizer with you. Your safety is in your hand. So these important tips we need to keep in our mind whenever you're going to use any public transport like rickshaw or auto. Just say that one passenger should be allowed over there. And whenever you are using like bus transport, and at that time maintain 6 feet distance, and of course wear proper mask. And whenever you are using metro and other transports, so at that time remember the COVID-19 appropriate behavior. And of course 2 गज की दूरी हम सबके लिए है ज़रूरी, ये हमें बहुत ध्यान रखना है, because COVID-19 behavior, appropriate behavior is right now is very important. When you are in market, when you are in mall, at that time encourage to stand away from the other person. Always stand in the marked place, right? And one important thing, that spitting is very important in our society. So let's do our bit and pledge not to spit, because it is an important thing in our society, and it is a very important appropriate behavior that we need to follow to slow down the spread of COVID-19, right? And whenever you are going in a religious place, at that time you have to follow certain appropriate, these appropriate behavior. When you are at home, clean the surface, clean your home regularly with sanitization, and do sanitization at your home. There are certain things are very important, like your door handles and keyboards and your remotes and other, like your mobile phone, your stairs. So always try to sanitize these things continuously on a daily basis, regularly, so that you can follow these preventive measures to reduce down the risk of COVID-19, right? And there are certain essential services are also there, like carpenter and plumber. So let them know about the appropriate behavior and tell them to follow appropriate behavior. So COVID-19 is not over yet, we all know about this thing, and in this festive season we have to follow these appropriate behavior and preventive measures. So I would like to request everyone that don't start visiting others and organizing big social functions, and stay at home and stay safe, right? So there, after this lockdown time, we can see there are many behavioral changes are occurring in our kids also, in even parents also. So it is up to us that how we need to handle this stress. Where there are a lot of cases are registered regarding the psychological problem, and of course anxiety disorders. These problems are rising up daily. So it is up to parents that we need to take care ourselves as well as our kids. So there are certain problems that we are facing, like sudden changes in mood behavior, and of course so as well as just whenever you're facing such problems, so always keep in mind that how to you have to follow certain preventive measures again for your mental health, like make your kids active, and of course practice yoga, meditation, and lots of healthy food, and sleep well. So these are the preventive measures that we need to follow for the mental health, right? So I would like to request uh, Dr. Sandeep uh, to um, to throw light on this issue. Thank you.
Thank you, madam, and very good morning to all of you. It's a really a great pleasure to be the part of the series. As already the colleagues have already mentioned to you the main aspects how the COVID-19, what is COVID-19, how this has happened. So let me give you some scenario that this is the pandemic situation which has come over, and it started from Wuhan, which is based in China in December 2019. That is why the virus name is COVID-19, coronavirus disease 2019, and it has been named as COVID-19. And from Wuhan in India, the first case has been found on 30th January 2020. When the first case it has been found, nobody was knowing how this situation is going to take over. And the first case we found in Kerala. And today, if you see the scenario in India itself, it has now we have around 84 lakh 62,000 cases all across country, affecting all the states of our country. As and other than that, we are already having around 1,25,000 mortality. So you can see now how the spread of this coronavirus has increased within a short span. So one thing which has come out very well, it's a viral disease, and currently there are a lot of there is no evidence-based management techniques which has come over for the coronavirus so far. So prevention is the only key to help us for this particular viral disease. And I would request all of you that as much preventive measures you people should adopt, the more you will be in a position to get away from this type of viral disease. So I think the three C's which they have highlighted, it is very clearly, that is avoid crowded places, closed spaces, poor ventilation, close contacts. Uh, Globally, if you see now, already around 4 crores 85 lakhs cases have already happened, and around 12 lakhs 31,000 deaths have happened, and it has already covered around 219 countries. That's why it is known as a pandemic. So once the lockdown has started in our country, the process was that the infection would not spread too much, and people were really adhering to the protocols, and they were really working on the various preventive measures which government was telling to them. But now, if you see that, what has happened is that there are a lot of once the unlockdown situation also started, there are a lot of implications to the students, to the children, to the working people, because people have started working from home. A lot of online classes have started. There is a lot of stress on the children also to be continuously on the online mode. So mental health implications of COVID-19 are much more. And that is anxiety, depression, and stress are the common psychological reaction for the COVID-19 pandemic. You must be seeing that your children at homes, they are having these type of issues because there are no locomotory activities. We are not moving out. We are all staying inside. The major impact of the COVID-19 which has happened is on to our old age people also. And because the old age people, if they are having any comorbid conditions like diabetes or sugar or cardiac diseases, they are more prone to get the infection, and the chances of the morbid mortality among these people are much more. Once this COVID-19 infection happens, as we all know that the common symptoms of these infections, which have already been elaborated by our colleagues earlier, there is no need to get panic, because 85% of the COVID-19 patients are having these mild symptoms only, and these are mild cases. Very few patients of COVID-19, they need the hospital admissions, and that is once your oxygen saturation falls below 90%, and your conditions of breathlessness and other conditions worsens, then you contact immediately with your nearby physician, get it admitted to the hospital. Everybody doesn't need the ventilation. That is very, very clear. This is the common myth that COVID-19 creates a panic and we have to move to the hospitals. No, there are nearby dispensaries of Delhi government. Go there, get your tested, get the reports of your test, and once you are negative, then don't need to worry on that. But if you are positive also, then also you don't have to worry. There are if there are mild symptomatic cases, the Delhi government has started a home isolation process by which you have to quarantine yourself at your home only, and then the doctors from the Delhi government will be on touch with you on telephones, and they make visits also, and then they provide you the symptomatic treatment of this viral disease, and 80 to 90% of the patients are recovering very, very fast. So there is no need to panic that COVID-19 it is not a stigma also. We don't have to stigmatize the person who is having the COVID-19, but isolation of that person is utmost needed. So the key messages, I think, which has come out from this COVID-19 is that we are in trying circumstances and we don't know what the future holds. Okay, we need to prepare for the worst case scenario and hope for the best. And in this particular situation, which nobody has realized, and people were saying that this type of pandemic has come after a gap of 100 years, because Spanish flu, which has come over in 1917, and exactly after 100 years, such type of pandemic situation has come over. Here, the healthcare workers are the important assets, and we have coined a term COVID warriors. Everybody who is working in the COVID fight, we have coined the term COVID warriors for them. We should provide them as much respect as much possible, because we don't know, we are safe being sitting in home and in our places. Those people are struggling on day-to-day basis, helping us, treating us, and also they are away from their families, because once they are into hospitals, they have to quarantine themselves also. They cannot go like morning they are going into the hospital, and evening they can come back to the families. No. So they have quarantined themselves. They are regularly working, and they are the major assets for our country, and we should respect them. And one message which has come over from this COVID-19 is that health is an investment. It is not an expenditure. Earlier, we used to think this is an expenditure, but it is not like that, but it is an investment. And we cannot afford to lose our productive hours and our productive people during this type of COVID-19 war. And let me tell you at the end that we do not grow when things are easy, but we all grow when we have challenges. No doubt we have a challenging time with us during this COVID-19 scenario. I think wearing of mask, keeping social distancing, hand washing, these are the simple steps by which we can easily protect ourselves and prevent ourselves from having the COVID-19. And these simple messages you can percolate to your children and to your neighbors also. And because ultimately any COVID cases in your locality, it is a source of spread also. So you don't have to take care only of yourself, of your family, but also of the locality and the society in which you people are staying. So tougher situations do not last, then let me tell you at the end, but the tough peoples do. So we all have to act as a tough people. We don't have to act as a simple, because the moment we give the loose end and this COVID-19, it doesn't know any barriers, it doesn't know any caste, it doesn't know any religion, but it is affecting from top to the bottom, everybody and all across the globe. As I already mentioned to you, 219 countries have already been affected. People are saying now in Delhi, another wave of the COVID-19 has started. You'll be surprised to know that yesterday the number of the cases are more than 7,000, which was highest in Delhi. So the festival season is coming over. This type of the festival, this festival season, we have to take care and make it utmost importance of all of us that let us celebrate with humanity. Let us celebrate in our houses, maintaining the social distancing. Let us not call our relatives and not, but be in touch with them on WhatsApp and phone calls and celebrate them and give them the messages of this particular celebrations also, or these festivals also, but kindly avoid the gatherings as much as you can. And my last word is kindly, this is a word of infodemics. Information epidemic has come over. We are all on WhatsApp, on laptops, we are all on the media channels. Don't rely too much and don't sit all the time, oh, this many cases have happened, oh, that many cases have happened. This will unnecessarily create a panic to all of you. Just be there for 5 to 10 minutes, see the situation, what is the situation in your city, in your country, that's all. And unnecessary spreading of the messages through WhatsApp to other people will create a panic. So be calm, we pray for safety of everybody, stay safe, and try to act as a good resource for others for passing a right information about COVID-19 prevention. So with this, thank you for giving me this opportunity.
Good morning, everyone. Am I audible? Yeah. I would like to thank Dr. Bhalla for this very informative session. Thank you so much, sir, for being here with us and joining us on the virtual platform to bring this information to our students and teachers and our very dear parents who have really cooperated during this time with us and have been a part of our online teaching and learning process throughout this trying time. So I would like to just say that it's a small message for everyone here that let's remember SMS: social distancing, mask, and sanitize. I think these three things, if we keep in mind, we can fight this virus. So let's do it together. And especially with the festivities going on, let's be very careful about the social distancing factor. Let's not throw parties. Let's not go to each other's house. Let's greet each other virtually and spread happiness through the virtual medium rather than physically going and meeting people. I think that will really control the situation because things are getting a little out of hand at this time, especially in Delhi, as the cases are rising. So I think we have to be very, very careful. And I think today's information also given by my staff members, that is Shweta and Vandana, must have helped you in the preventive measures to be taken. So a very happy Diwali to all of you from our family at the school to our family sitting at homes. And also, I would like to say, stay safe and take care of your health and look after your immunity also. Thank you so much for being here.